Nobel Peace Prize, unions have raised concerns on why South Africa is not honouring its own healthcare workers. Now, Cabinet has already approved the nomination of the Cuban doctors who were assisting with COVID-19 treatment. Joining us now is political analyst Angelo Fick to give us more analysis. Now, Angelo, good afternoon. South Africa's nomination of the Cuban doctors for the Nobel Peace Prize has raised many questions. In your own analysis, is the South African government justified to nominate Cuban doctors?
Well, my first question is whether the South African government met the deadline, because the president indicated on the 1st of February that the cabinet has thrown its weight behind a nomination, but the deadline for nominations was midnight on the 31st of January. And the South African government certainly has or qualifies to be a nominee for this prize. But if it didn't meet the deadline, then, the organization wouldn't be considered in 2021, but only in 2022. As for the actual merit of this particular nomination, I think these nominations are always slightly controversial. I think, many South Africans critical of the nomination might be thinking only of what Cuban doctors have done in the specific local, or what that program has done in the specific local South African context, when actually the nomination may have to be about what the Cuban doctors program has done around the world during this period and what the program has done more generally over the last few decades. And in that sense, the activities of the Cuban doctors certainly extend beyond merely what they've done in South Africa since the outbreak of COVID-19, and also what they've more than what they've done in South Africa more generally. What they've done around the world is certainly far more impressive when one puts it in context of the situation of Cuba as an embargoed economy, the very small country that it is, and the impact of its medical fraternity around the world beyond merely its own borders.
Now, Angelo, if you may, just also talk us through the historical ties between the two nations and just the nature of the relationship and how this could have influenced the decision to nominate the Cuban brigade.
So the relationship between Cuba and South Africa goes back to the African National Congress in exile. So this goes way back to the 1960s, and one of the most senior ANC officials and Communist Party officials, but also a major South African novelist, Alex Luguma, was situated in Havana for decades of his life in exile. Beyond that, the Cuban government was also one of the first governments to support the ways in which the apartheid regime was delegitimated in the international space. And then beyond that, in the 1980s, from the late 70s and through the 1980s, the Cuban military assisted the Angolan government, for example, against the incursions by the then apartheid South African Defense Force. Often, and these kinds of ties between the African National Congress in exile and subsequently the African National Congress in government and Cuba are strong ties. But I don't think that alone explains why the Cuban medical fraternity in its work beyond the borders of Cuba would necessarily, justify their nomination. Let's not forget that Fidel Castro came to South Africa for the 1994 inauguration of Nelson Mandela. And the moment he walked into the Union Building amphitheater, the entire congregation of people there stood up to applaud and laud him. Castro's own death, many years later, was also a source of an interesting shift in global politics, because here was a man who led the government of a very tiny island against the most prolific and most militarily powerful country on the planet in the history of humanity, quite successfully defying the United States in all sorts of measure, not least his own assassination or the attempts on his life by the United States. So there are complicated reasons for the relationship between Cuba and South Africa, but I don't think that those are the only reasons that account for why the Cuban doctors would merit a nomination for a Nobel Peace Prize. Their activities extend beyond Cuba into their own hemisphere, so across Latin America, into Africa. They were one of the first countries to assist during the crisis around Gaza in the Middle East. So, and the training of medical personnel in Cuba by the Cuban government for people who are going to serve elsewhere in the world is also significant. And so this is not just a kind of, oh, they sent some doctors to South Africa. Whether or not the president and the cabinet are justified to make this nomination without consulting South Africans first, that's a different story.
So, of course, we have noted some reservations, notably coming from Nehawu here, with many also wondering why our own healthcare workers are not being recognized for their sacrifices at ill-equipped hospitals with very limited resources. Do you believe such concerns or these kind of concerns are warranted?
I think Nehawu has a very valid point around government's relationship with healthcare workers, but they've had those concerns for, the last 26 years in post-apartheid South Africa. So it is interesting, and I think it is ideologically strategic of them to use this moment to hold government to account, and the president certainly does have to explain. As a society, beyond merely the ANC government, as a society, we have certainly undervalued healthcare workers in this country immensely. Over the last 20, 25 years. This is not to say that in apartheid they were particularly valued. I'm simply saying us as a society taking control and responsibility for the country in 1994, we have much to explain because these are often some of the most precariously employed workers. As you pointed out, some of the least well-resourced people in the country working often at great danger to themselves. One thinks of the GF Jooster hospital in the then Manenberg, having to serve communities and doctors and nurses constantly putting their lives at risk because of gang activity that infiltrates into the hospital. One thinks of the very low wages that beginner nurses have to earn. And Donosa and Nehawu have serious case against government for the way in which medical personnel are treated by government in government facilities. And then through the crisis, the very poor, shall we say, resourcing of such workers, not least because of the corruption through the PPE scandal, and the long period that had passed between the outbreak of the virus, the development of vaccines, and the pressure government had to be put under to communicate with South Africa what its vaccination plan was for healthcare workers in public. And that, I think, is crucial because people often think of healthcare workers as, ER doctors, and I mean the television program, when actually most of us are either related to or know very well ordinary nurses who live in townships, who are our mothers, our sisters, sometimes, people we studied with, people we've known all our lives. And we know the stories of what it means to be a nurse in a hospital, in a public hospital in South Africa. And for that, I think it is important for the South African government, in addition to its desire to shall we say, reward the Cuban doctors' fraternity, they must begin to address the shortcomings and the shortfall of the way in which South African medical personnel in the public health sector are treated, rewarded, and valued.
Now, as we wrap up our conversation, I want us to stay a bit on your last point. There's also the sentiment that South Africa recognizes our own medical doctors, or rather that they should recognize our own medical doctors by paying them more money and also give them better benefits. When one considers the difficult conditions that our healthcare workers have to contend with, some would agree that more could be done to assist in their plight. What are your thoughts on this?
Absolutely. One thinks of the work of Professor Shula Marks on nursing in KwaZulu-Natal in the early 20th century. And to some extent, very little has changed for the majority of the Black women who populate the nursing fraternity in South Africa. This is a very devalued and absolutely essential, it turns out, as the crisis showed us, component of South African healthcare, provision. And the fact that people earn what they do, and right at the beginning of the COVID crisis, nurses started putting on social media what it is they earn. And it is interesting to see how many South Africans on those social media platforms derided the complaints of the nurses, suggesting that these salaries, and when one looked at them, they were often take-home pay with 4 digits before the decimal, were acceptable for people who not only had studied to become this, not only with performing essential services, but were putting their lives at risk during a pandemic. And prior to that, were putting their lives at risk just from an ordinary accident and emergency shifts, because the violence of our society also operates in the violence of the hospitals that these people work in. And so it is absolutely appalling that the people who do the most valuable work, which I think, only got to realize, some of us have known it for decades, but some people only realized it when the emergency crisis hit, that they're paid as poorly as they do, that they work the kind of terrible shifts that they do, and under the horrible conditions, as poorly and under-resourced as they have to. Ask the nurses and doctors of the Free State, ask the nurses and doctors of the Eastern Cape hospitals. The conditions under which they work, actually unacceptable for a middle-income country in which our politicians each earn over R1 million every year for sitting in parliament, and not much less than that for sitting in our provincial and our municipal legislatures. This is, income inequality and an injustice that has to be addressed as a matter of urgency.
Well, Angelo, thank you very much for your time. That was political analyst Angelo Fick giving us his thoughts about plans to honor the Cuban Brigade. Now, this has sparked some apprehension from Nahau, which says that South Africa should do more to honor our very own medical workers. Let's move to this now. Coca-Cola